to the 9 p.m. edition of the Urban Debate. One more time, let's put the spotlight on what matters a lot to you and me, and that's employment. That's the jobs conversation that we regularly have here on Mirror Now. And for over a year, we've been talking about a jobs crisis. Now, viewers, that's just got escalated further. And that's simply because of coronavirus, the lockdown that we are all witnessing, and a global slowdown because of coronavirus. Let me just actually give you some of the latest data that's come out. And the latest information, by the way, is also from one of the big companies, Oyo, that has just, as we come into this show, announced a 25% pay cut for its employees for effective April to July 2020. But Oyo is just one case. From Go Air to several other travel and aviation firms, to retail and FMCG firms, to even media services, we are looking at tough times. And this is obviously happening because there is absolutely no economic activity taking place. Not here, not in our country, not in anywhere else in the entire world. So if you look at the data, as per the CMIE, the unemployment rate shot up to 26% in April 2020. But 14 crore people have lost employment already during the lockdown period. Here is how bleak things look for 2020. Fitch has slashed India's growth forecast to a 30-year low of just 2% for this year. IMF has actually put it at a lower number of 1.9% for this year. Moody has cut the forecast to 2.5%. S&P Global Ratings has cut our estimate to 3.5%. Now, this is a country that till January 2019 was actually growing at over 8% as per the government figures. We are now looking at completely coming to a standstill and recording hardly any economic activity. So layoffs, salary cuts, leave without pay are all realities of this new world in 2020. How do we deal with this? How do companies deal with this? Can the government come in any way and help the people and help the companies? Should there be a payroll protection plan? What can be done? How do we make this easier on you and I, our companies, businesses, and what can the government do? That's all that I want to talk about one more time. So let's say good evening to our panelists. Devashish Sharma, founding member of People Strong, joining us this evening. Gopal Agarwal, national spokesperson for the BJP. We'll also have Aditya Mishra, CEO for CIEL HR, joining us shortly. But first up to Devashish Sharma. Devashish, it's going to be a rough year. Once we are done with the health emergency, there will be another one. Now, how do we go about it? Salary cuts, saving money, work from home. Is there a certain template across the world that can be looked at as an example for what Indian companies should do?
Tanvi, hi. Surreal times, unprecedented times. I think we actually are already working in this cookie cutter work from home, new way of working, the new normal. It is very, very important that industry gears up to be able to cope with this and bring about a lot of measures, whether it is upskilling their talent and also giving some kind of measures that will help their people. But these could only be temporary and last a few months. What after that is the question. I think it is the opportunity for us to move to a partial contractual workforce, a gig workforce, tying it down with a lot of skill bodies to be able to come together so that organizations can, even today we have a huge surplus of people who are willing to work as a gig workforce, and my organization, tagged by People Strong, is tapping, and almost 40% of what we hire come from this pool. So I think there's a whole change that we're going to see in the demographic of a large chunk of permanent jobs moving to contractual workforces, which I believe will really help in the long run. Candidates, people seeking jobs will need to upskill themselves, will need to have multi-skills to make sure that they remain employed. Of course, there are other large things that even the government can do. The government is already doing, and irrespective of our political affiliations, we've got to rally behind the government of the day and make sure that the government can, of course, have great opportunities in leveraging Make in India and campaigning and using diplomacy across the world to take and seize this opportunity to manufacture within India in the next year, and that could be a big path breaker for this nation.
Yes, okay. So let me also bring in, Mr. Gopal Agarwal to just get his opening comments as well. Mr. Gopal Agarwal, while times are tough, it shouldn't become an opportunity for companies to also, look out at cutting costs where they can and using this as an excuse to get, to lay off people, to cut their salaries and save on some money. How do we ensure that that doesn't happen?
The issue is complicated, and definitely it's a cause of concern at the government level and at the industry level also. We have been meeting them. They are showing this concern about the salaries, high cost of salaries that the industry, particularly SMEs, have to pay. And they are looking for certain support, and the government has provided for particularly on this ESI and PF contribution for industries, those are having less than 100 people, that both employer and employee contribution is already has been being paid by the government. Similarly, credit availability, particularly the last announcement by the RBI of TLTRO contribution of 50,000 crores and 50% of that reserved only for small SMEs and NBFC, and another 50,000 crores of fund allocation through SIDBI, NABARD and NHB, and then NBFC giving moratorium for them for real estate. All these issues the RBI is looking after, even the central government is working on them, and even on the lower strata for laborers and daily wages, etc. The government has come out with direct benefits. Even UP government has given 1,000 rupees for 15 lakh daily wages. So all issues are being looked after. They are into consideration. There are definitely what problems you have put forward is a concern, and surely the economy is in a difficult situation. But the priority of the government initially was to strengthen the health infrastructure. Then it came to providing food and shelter to the migrant labor and other lower strata of the population, giving. Then the third was giving direct benefit transfer to these people in the poor people segment, needy people. That now the government is now focusing on economic revival. And if you see, I have been discussing at the international forums also and domestically also. Surely the current economy is a cause of concern, but we are going to see a huge V-shaped recovery for India. Otherwise, you can't see such a confidence of the global investors in India. You see, today only Jio, Facebook has invested into Jio. Then Prime Minister 3 days back wrote a big article in LinkedIn about how the new economic system will work. We are working on new manufacturing policies. All these issues surely will revive our economy. It's a difficult time, but as it is said, that this shall also pass off. So this is a situation, it will pass off. We have to stand for the poor at this point of time, but industries also are required that will be taken care
but
of. We
I
have
don't
ample
understand this
space.
argument, Mr. Gopal Agarwal. You can't tell me that because you're dealing with the health situation first, you will look at the economy later. There's a different health ministry and there's a different commerce and a finance ministry as well. In fact, we have a large number of ministries and departments and individual ministers and group of ministers, then empowered group of ministers, special committees and officials who are all supposed to look at various aspects. Now, here is what some of the other countries are doing. South Korea has given relief to lower income households up to $820 per household. Ireland has given a temporary wage subsidy that's gone up to 85% now, with net weekly take-home pay increased to €412. UK has given 80% government funding for employers for the next 3 months. Funding for workers for salary has actually gone up. In US, there is any which way a payroll protection program that was brought in earlier when times were tough. They now have income support for families for $1,200 per adult, $500 per child. Spain has a full salary for affected workers during lockdown, ban on outright dismissals, allowance for temporary workers and household employees. Italy has a €5 billion top-up on wage supplementation program. France, Germany, Japan, all of these countries are also dealing with the same problem that we are dealing with. Where is our economic package?
The economic package, there were 3 economic announcements by the government. 2.47 lakh crore was for the poor sections, and 49 crore household bank accounts have received money through direct benefit transfer. Already, lot of money has been transferred by the central government. Earlier, the central government had announced a 62,000 crore package for the health industry. Similarly, there was an automobile industry. There was a fiscal stimulus package. RBI has in 2 tranches announced a fiscal stimulus package of 7.54 lakh crore. Yesterday, 2 days back, 1 lakh crore, earlier 6.54 lakh crore. So this total comes to about more than 5% of GDP. This is in addition to what the government is further going on the daily basis: relaxation on tax compliances, relaxation on moratorium on tax payments, etc., and EMI, other things. These are not financial benefits that the government has considered into this package. Whether it is EMI relaxation, whether it is moratorium on loan, NPA recognition, 1 year has been completely no NPA will be recognized.
These are things that you're giving to
industry.
Moratoriums. Okay, moratoriums is good, and tax cuts are good for the industry. You will make some of the industry top honchos and CEOs very happy, and they will pat your back. But is that impact going to boil down to the last mile worker? 1 minute, Mr. Gopal Agarwal. If you are going to give this help, you need to take an assurance from these companies that the tax cuts actually benefit their employees. That you don't stare at a situation where employees are still being sent home on leave without pay, that their salaries are getting cut, that people are being fired, on a daily basis in one company or the other, while they still pocket all these profits from you. An economic package doesn't mean announcement of XYZ lakh crore rupees on paper. You have to ensure that you protect jobs of people while the unemployment rate goes up. Now, what do we do about that?
No, that's
the big question. Aditya Mishra, CEO of CIE and HR, is also joining us. Yes, go ahead, please. Yes, Mr. Agarwal, finish your point.
I told you initially the government has announced, which has, I don't know why it has not got such a big space, that PF contribution on ESI and Provident Fund, employer and employee, both will be paid by the central government. That is almost 24% of help to the industries. Per employee, 24% help on ESI and PF is a big amount of salary contribution that is there, and even the credit availability has been increased. So even there is a talk about, some people are asking for interest rate subversion. Government will definitely working on various other, it is not the end of the day. We are working on other packages also, and it's a staggered decision that the government is taking, and there is ample fiscal space,
Okay.
no need to worry.
Meanwhile,
RBI
meanwhile,
has given borrowing
80,000.
powers.
Meanwhile, according to the Retail Association of India, 80,000 jobs are expected to be cut by various retailers. In fact, I can tell you, many of the FMCG companies have already started cutting off their third-party
Yes,
vendors
that's a problem.
and support services that they have. So that's happening. 1.5 crore jobs could be lost in India's export center, says the Federation of Indian Export Organization. There is a larger problem that we're looking at, and I want to highlight this point and bring in Aditya also, on that angle. Aditya Mishra, how do we ensure that while companies get relief from tax cuts and loan repayments to availability of funds for working capital and all other kinds of relief from the government, that they, on the other hand, still don't cut costs by laying off people, because that still seems to be happening out there?
Yeah, I think the packages that the government has announced, we have to kind of understand that which segment is getting the benefit. I think the direct benefit transfer, which is happening, that's largely benefiting the unorganized labor. It's not really impacting the people who are working in the organized workforce. The job cuts that you mentioned are more in the organized workforce, while the government has made an appeal to the entrepreneurs and to the industry, India Inc. in general, to not lay off and to not cut the wages of the people. But where this money is going to come from is a big question for the for these employers. So I think the PF and ESI, whatever has been given, the kind of a temporary relief to the companies, that's only applicable for small companies who employ less than 100 people. So, then what happens is, anyway, many of those people do not have PF and ESI because they do not qualify for it. So, this benefit which has been given is not translating adequately. The large organizations are, in fact,
Correct.
impacted by this because the organizations, there is a moral responsibility for those organizations, and there is an appeal from the government. Organizations, everybody are not making profits. You know how many companies in India are paying income tax because they are not yet making that amount of profits. So the relief which is being given is for the moratorium on the loan payments, but the company needs the cash to keep these people on their payroll. So the payroll cost, actually the relief which is possibly required, is like you read out what South Korea has done, what Italy has done, what UK has done. Those are the kind of relief what the organized sector is really looking for. I hope that our government has the wherewithal to really support to that extent. That's number one. And number two, hopefully some of these will come. Otherwise, after this lockdown is lifted in the month of, let's say, in the month of May, and as it looks like it will be staggered. So some of these companies, by the time their cash flows start, it will become possibly June and maybe later. So how will these companies be able to keep on paying salaries to their employees while they have to do some cost adjustments, and many of the companies' employee cost and the fixed other costs are fixed for them. They cannot really adjust it unless they let go of some of the employees. Of course, some innovative methods companies are talking about, like deferring payments or restructuring salaries by making partly fixed and part of the salary making variable. This is, of course, a much better innovative method than laying off. So at least the person has the job, and hopefully the 3 months situation becomes better, and the organization and the company is able to really get back to normalcy as the revenue streams improve.
Well, I'm going to Thank you, gentlemen, for joining us right now. I wish I had more time for this conversation, but I will request you all to join me another day for a more detailed conversation because, just like Mr. Mishra said, while some amount of stuff has been done for a specific section of people, for the organized sector, there is still a lot of help that's needed. And I think when the government lends that helping hand, it should be with the condition that you ensure that your employees are protected, that people who work for you are protected. Keep in mind, there is a ripple effect here. People who get laid off will not be able to pay those who work for them as well, including their domestic help, including their drivers and everybody else that becomes a part of their support staff. Similarly, smaller businesses who don't get help from the government today and have to start shutting shop, they will have employees, 10 employees, who will not have any work and will not find any work in such times. Their families and their people dependent on them will begin to get impacted. So the ripple effect has to be factored in, and the government needs to also move faster on this issue. Thank you, gentlemen. I'm sorry we will have to cut short the conversation today, but we will keep it together for another day. Let me quickly move across and say good evening to Mr. Tope, Maharashtra Health Minister, who is joining us right now for a quick conversation on what's happening in the state of Maharashtra, the state with highest number of cases, and specifically the city of Mumbai that itself has seen over 3,400 cases already. Mr. Tope, one thing that the whole state was banking on, especially cities of Mumbai and Pune, were the rapid testing kits. Now, those testing kits have been put on hold. So, what is going to be your strategy to find infected patients and isolate them?
No, basically, I should make it very clear that the rapid test itself is not a very accurate or precise test wherein we can really identify or we can make it that whether the report says whether the patient is a COVID or not. So one thing is very clear, rapid test is not for detection of COVID patients. RTPCR is the technology which is widely used across the globe for this identification of COVID patients, number one. And so rapid test is just for the sake of knowing that whether the person is having like infection or not, or for screening, at mass screening, I mean to say. And because after having the rapid test done, then also for the confirmatory, we again have to do the RT-PCR test, because we can only keep faith on RT-PCR only, not on rapid tests, because rapid tests are only for screening. That's and the whether the infection which is there in the body, whether it is of from coronavirus or not, cannot be said from the report of the rapid test.
Okay, no, I understand that. In fact, even the ICMR has constantly said that rapid tests can only be used for surveillance and not actually be used to find out whether or not somebody has coronavirus. So I get that point. Mr. Tope, but you know, the city of Mumbai itself has become a huge issue. There is a central team from the central government which is currently in the city taking rounds of the kind of strategy that is being used on ground. Now, what has been the conversation like with the center and this team? What needs to be done for Mumbai?
Since 2 days, we are continuously in touch with the Government of India team, which has come here under the chairmanship of Mr. Joshi, who is secretary over there. And so we are in touch with them. They are taking the stock of whether the protocol of ICMR is being followed or not, or the cluster containment strategies which has been issued by Government of India are being scrupulously followed or not. Are there any lacunas in that? So the stock they are taking from from closely, they are taking the stock. I also was there with them in a couple of places like Dharavi and all, and they found that yes, it is in place, everything is in place. Only thing is there are some suggestions which they have given, like the institutional quarantine. They wish that they should increase the numbers in the institutional quarantine, And of course, I spoke to Mr. Praveen Pardesi, the Commissioner of Mumbai Mahanagar BMC, and he has also assured, and we are also planning that yes, the institutional quarantine number should increase. At present, the institutional quarantine number is somewhere about around 5,625. But now, even we are ramping up the capacity of institutional quarantine to the tune of 75,000. Like on all the schools, the community halls, and even if required, hotels also can be kept for quarantining people over there. So the challenge mainly is how to quarantine the Dharavi people from the thickly, densely populated area or the slums. In one room there are 10 to
Hmm.
15 people living in that room. So if we cannot say to be just home
Correct.
quarantine, because home quarantine basically says that we should apply, or we should the social distancing cannot be maintained in a small room of 10 people living there in 10 to 15 numbers. So they have to be shifted to some other
Okay.
place, and that is
Hmm.
being properly now we are opening we are like number of schools and community halls are being opened to institutional quarantine the people over there.
So, who will be these people who are moved out of the slum area to these locations? Will they be
you see,
family members and close contacts of those who've tested positive, or are you simply looking to declutter the entire slum itself right now?
no, the first point what you mentioned, like close contacts or the family person, those of a positive person, a person who has found
Hmm.
positive, is all the family members and all his neighborhoods should be isolated in the quarantine area.
Okay.
So that is the main objective behind that. Then and then only the spread can be uh, really contained.
Mr. Tope, because there was a report today in one of the newspaper dailies that mentioned that a central team's projections show a very, very high number, almost 6 lakh patients likely in the city of Mumbai by 15th of May. What is the state's response to that report that's emerged?
No, basically that is, I think there is nothing. The authorized committee which has come from Government of India has not submitted any report at this moment. Up till now, they have not submitted any report to Government of Maharashtra. But yes, in one of the newspapers, some mathematical model calculation has come over there. In a period of from 30th April to 15th of May, there may be too many cases coming up in Mumbai, and so the preparedness will be totally collapsed. What the news says in such a way. I think there is nothing like panicky situation. It is a mathematical model which says if we are in a static condition, static means we are doing nothing. If the
Yes.
condition remains same, like that, suppose the doubling rate what they have considered is 3.4. So now the doubling rate is
Hmm.
7%. So at this point of time, when the doubling rate is 7 and we are continuously increasing it, like the numbers getting doubled, the number of days are increasing. So these mathematical calculations which has been done by some mathematical model is it does not
Hmm.
really come true, does not always really come true, but yes, we should always hope for the best and prepare for the worst. So that is the
But is the
philosophy
state, but
which
is
I
the
believe
state
in.
analyzing that report and yes, but is the state, has the state looked at that report and analyzed that report to see what mathematical equations were used for those projections? What is your own internal assessment showing?
No, basically we are completely hopeful that these numbers will not at all come true, not at all. But yes, if some numbers are increased, then we are ready, and we are totally planning to increase the quarantine facilities in Mumbai, isolation beds in Mumbai. every bed should have oxygen facility at least to the bedside. So those things are being taken care. Also, the number of doctors and the task force, which wherein there is an expert team which continuously guides, or if I mean to say, the mentors the doctor who is treating the critical patient in giving the advice, proper advice to treat the patient. And even we have brought down the death rate. Like it was priorly 7%, now it has come down to less than 5%. So death rate has completely, we have, the death rate is declined, I mean to say. Also, the doubling rate is increasing, like the number of days are increasing. So I am very much optimistic, very much hopeful that the numbers which has been shown may not come true at all. And even for in such a situation also, whatever possible ways required for the preparedness, we are continuously behind that, using new technologies, using new
Well,
methods of surveillance. Surveillance is being aggressively done by more than 3,000 teams of surveillance team, which are continuously day in and day out. They are continuously moving from house to house, seeing to the patients, seeing to the persons whether they are having any symptoms, and then quarantining them. So aggressively we are doing that. And I think
hmm,
when the testing, highest number of testing is also being done in Mumbai. More than 51,000 tests has been conducted in Mumbai by different private
correct.
labs and government labs. So I think seeing to such type of efforts which are being taken, these numbers may not come true at all.
Okay, okay. So let me ask you this question. And Mr. Tope, before you joined us, I actually had a special conversation with experts also on the state of Maharashtra and Mumbai. And one of the things that, a top doctor from Lilavati also raised was that we need more, hospitals, because currently there are quite a few hospitals in Mumbai that have had to shut down because there is of a issue of a quarantine. Many of them are, also busy with, already overloaded with COVID patients. What is the government planning to do about that? Not just for COVID patients, but also other emergency cases, other non-COVID crucial cases.
No, I think in all respect, basically there are three types of categories which we had made. One is critical care center. Second is dedicated COVID health center, wherein the mild and moderate type of patients are being kept in these sectors of hospitals. And there is a dedicated COVID hospital where the critical patients are treated. So there are three categories which, as per the advice of Government of India, we have designated all the hospitals over there in Mumbai. And I think there should not be any problem. There are isolation beds in all the hospitals. So if required, also there are hundreds of numbers of private hospitals which we have not touched at this point of time, but we can, by virtue of the Epidemic Disease Act, we can also get hold of all those hospitals as well, the number of beds also, and the doctors also. But
Okay.
we have never touched those
Okay.
hospitals. But yeah, at this point of time, we are quite. There is no, I mean to say, dearth of any hospitals or doctors at all.
Okay, let me ask you one last question, Mr. Tope. What about, plasma therapy trials? Is Maharashtra looking at beginning those as well?
Yeah, plasma therapy has been in experimentation. Like in Kerala, also they are experimenting. In Mumbai, we are also experimenting. And so the plasma therapy is a therapy wherein the patients who are totally discharged and they have a lot of antibodies in them. So the blood and the plasma is taken out from those who volunteer this plasma. They come forward and they give their plasma, and from that we can inject the plasma into the critical patients, wherein they can. So this is an experiment which 100% we will be doing in Mumbai Corporation. We are planning. Our task force is planning in that aspect, and I am hopeful that this therapy, if proved well, successful, we can go ahead in in application of this therapy very aggressively.
All right, Mr. Tope, thank you so much for speaking to us and giving us your time and also clarifying on what the state government has to say on that report that was published today with staggeringly and alarmingly high numbers being projected for the city of Mumbai as well as Maharashtra. Thank you for speaking to us. We're going to take a very short break. Lots more on the other side. Once more, the spotlight on rapid testing kits. Stay with us. Welcome back. As promised, one more time we put the spotlight on these rapid testing kits. The kits that we've spoken so much about, the rapid test kits that were supposed to help us with our testing strategy and help us in our fight against coronavirus. Now, as you know, viewers, yesterday we told you that the government and the ICMR have advised the states to not use the kits that were imported from China. 5.5 lakh kits were actually delivered by China a few days ago. These were then sent to several states. And when the states began to test these kits, they saw problems. 3 states have actually raised the alarm and the red flag on that. West Bengal was one of those states that said that rapid testing has been held till clearance from ICMR. 78 people were tested on April 20th and 220 on 21st. But now there is a problem. Rajasthan was one of those states that actually the government responded to and referred to in its news briefing also, where Rajasthan said we followed all the ICMR guidelines for testing. Still, the accuracy of these test kits was only 5.4%, and so we are not going to use them anymore. Then we also saw instances in Punjab. In Mohali, these testing kits were used where the results were completely not matching with what the regular test was showing. So as we speak, these Chinese kits have been put on hold and are not being used as ICMR investigates what's going on. Are we not following the rules properly? Are we not following the guidelines or the protocols? Is it a problem because it's Chinese product and there is a quality issue there? We have had some of those in the past as well. Or is rapid testing kit as a concept only not really advisable? Let's ask our panelists who are joining us right now. Dr. Velamani, Chairman and MD of Thyrocare, with us this evening, and also Dr. Vinay Goyal, MD for Life Care Diagnostics. Thank you so much, both of you gentlemen, for joining us. Dr. Velamani, let's begin with you. This new hurdle that has emerged threatens to derail our entire plan. What's your own view about these Chinese kits?
Tanvi, our plan itself was wrong. If we felt these rapid kits are going to be a solution, will replace PCR, will help us to diagnose faster, it was a wrong plan. The writing was on the wall. 20 days back itself, many other countries have rejected. You look at it, last 15 days, not less than 10 countries have stopped using rapid kits. When everybody has stopped using, we started importing. So I am not shocked, surprised about what is seen as outcome, because these antibody tests do not have sufficient sensitivity to identify antibodies if present. But antibody itself may not be present for the first 7-10 days of the exposure. So there is no way we can use this antibody test for diagnosis. It is only meant for surveillance, and that is not for diagnosis. We felt individually, all state governments felt that that is a solution. Largely under pressure from the opposition, they felt that if we don't buy, they will all think that government is not spending, and they have spent on it. In my personal opinion, it is not China product problem. It is the rapid kit which have limited sensitivity. Mind you, this infection is in lungs. It is not in the rest of the body that much. So you don't expect too much of antibody circulating in the blood. So in my personal opinion, this antibody test at any point of time cannot be used for diagnostic. And that is what ICMR had understood finally. It knew it early, but it could not stop using it. And after using it, now they have decided, let us now tell not to do it till we do adequate experiments.
Okay, but Dr. Goyal, the government and the ICMR have actually also sometimes said that, well, we are not using it directly for diagnostics, but more for surveillance. And yes, there are lots of conditions when you should use it, how you should interpret the result. Do you think, keeping all of this in mind, it's advisable to not use these kits at all? Or what do we mean when we say use it for surveillance but not for diagnostics? Dr. Goyal, I'm afraid we are unable to get through to you or hear your voice, so I'm going to come back to you in just a bit. Dr. Velumani,
Can you hear
just
me?
to
Can you hear me now?
understand
Can
that
you hear me?
difference, even
Hello?
for our
Can you hear
viewers,
me
when
now?
we...
Hello? Can you hear
Okay,
me?
okay, I believe we
Yeah.
can hear Dr. Goyal now. Yes,
Yeah.
Dr. Goyal, go
Okay.
ahead.
So I was trying to say that we need to understand what is the purpose of doing these kind of tests. And as you rightly said, and your question is that whether we should completely do away with this test, is it really required or not? I have to give my opinion on that, that both the tests have different values. The PCR test is for diagnosis, confirmatory test, and the test for the antibodies, which is the rapid test, is meant for surveillance, for understanding whether you have developed the antibodies or not. So to say that this test will not be required in future, I would say no. It is definitely going to be required, according to me. It has to, but however, go through the right validation. So what has happened across the globe, in the rush to try to issue the rapid test for the purpose of doing mass screening, they have tried to rapidly introduce a rapid test without enough validation. This is what is my understanding. And I feel that if every country goes through a real validation process, sees a kit in the right manner with the right accuracy, this kit will be of good value to understand how many people have developed the antibodies and then to demarcate them separately from the active infection people. So I think both the tests are complementary to each other at some point of time. RT-PCR is the most important test. We should increase the testing capability of these, definitely across the country.
And I understand what both of you are saying, and in fact, that was the sense I got even from the earlier conversations we've had about these kits. But again, the problem is that are the states and those who are using these kits on ground really understanding it? Because the problem that has been raised by everybody is, oh, it's showing variation, it's not the same result as what RT-PCR is giving us, there is something faulty with this kit. So is it a point of faulty kits, or are we not using it correctly? Dr. Goyal, let's start with you and then I'll go to Dr. Velumani.
So we have to understand the process and why this test is being done and at what phase it is. So this test comes positive in the antibodies only after 7 to 8 days of exposure to COVID in any form, right? And having said that, if you are doing this test within this window period, you may get a false negative. These tests, which are rapid tests, have high false negative and high false positive ratios. So when you are trying to do this test, you have to see in what phase you're doing. So when you're doing at ground level, the people who are performing this test have to understand what this test is all about, when it should be done, and how it should be done. There is a temperature controls. You have to have certain temperature in which the test has to be maintained. And there is a way of doing a test too. So there could be analytical and pre-analytical conditions where you could be making errors. However, I'm not denying the fact that the kit itself could be faulty, which is possible because across the globe, US, UK, Spain, they have all complained about faulty kits, and everybody cannot be doing a wrong way of doing the test. So obviously, we are facing a situation here. But I'm not saying the kits are not faulty. It could be, and it definitely has to be because there's so many people doing it. At the same time, we cannot say we should not be doing rapid tests. This is what I'm trying to come out of this conversation.
Okay. So, Dr. Velumani, if we talk about surveillance, and we were given to understand that these kits were also going to be used to study whether or not there has been community transmission in the country. In absence of these kits, let's assume that tomorrow ICMR confirms that yes, they are faulty and they have to be sent back to China, and then we'll have to wait further for some more test kits to arrive. What happens in the meantime? What should our strategy be?
Yeah, actually, the feeling that antibody test can be used for diagnostics itself should be first forgotten. You just cannot use antibody test for diagnosis. Full stop. It can be only be used for surveillance. But to use it for surveillance, we have three technologies. The antibody test itself can be done in three different technologies. One is rapid test, which we have found inferior. That is not a new finding. Always rapid tests have limited use, limited sensitivity. So that was a wrong candidate in our hand to understand the power of antibody testing, number one. Number two, the ELISA test is another technology which is yet not coming to the market. It will take another 1 month's time to come to the market. The rapid test, lowest sensitivity, not quantitative, only qualitative, whereas ELISA test has higher sensitivity and also it has got a kind of ability to quantify, semi-quantification. There is one more technology which is chemiluminescence. When it comes, it will tell you exactly how much of antibody is present, if present. But mind you, even the most sensitive chemiluminescence also cannot serve the purpose of diagnostic. It can only serve the purpose of surveillance. So, even if you want to do surveillance, you should not do rapid test. You should wait till ELISA comes. You should wait till chemiluminescence comes. Otherwise, your surveillance itself is a very wrong data.
Okay, I'm completely out of time on this conversation, so I'm actually going to thank both of you. But this is the important part, and this is the key takeaway from what both of them are really saying right now. Firstly, rapid testing kits cannot be used for diagnostic. Now, what does that mean? That it can't really be used to say, okay, let's prick your finger, let's finish this test in 15 minutes, and this is the result. You're either corona infected or not, and take it as a final result and go home. No, it can be indicative of something, but people still have to get the proper RT-PCR test done. That's essentially what all experts have been saying. So when the state governments actually begin to use this, they have to keep it in mind. Also, there is a specific time when the rapid test kit should be used. It can't be used in the initial couple of days after you've been exposed to the infection. It only reflects the true signs after a few days, after you're tested a few days later. So there are a lot of these guidelines that have to be maintained. But the big problem right now for us is, even for surveillance, even for a larger direction of where we are headed and what the larger numbers are showing on grounds in big cities, in crowded clusters, we have to keep in mind that these kits right now are under investigation, and ICMR has to tell us whether they can be used, or a new batch has to come either from China or from some other country. That's a wrap on this conversation.